Welcome to our channel. Today, we're diving into an important medical procedure that can save lives, the colonoscopy. Whether you're preparing for your first colonoscopy or just curious about the process, we've got you covered. From preparation to what happens during and after the procedure, we'll walk you through everything you need to know. So, let's get started. A colonoscopy is a crucial medical procedure used to examine the inner lining of the large intestine, colon, and rectum. Its primary purpose is to detect abnormal growths or polyps, inflammation, and sources of bleeding. The procedure is also valuable for collecting tissue samples, biopsies, for further pathological examination. Number 1. Dietary restrictions and bowel preparation. Preparing for a colonoscopy begins several days before the procedure to ensure the colon is completely clean for a clear examination. Initially, you'll switch to a low-fiber diet, avoiding whole grains, nuts, seeds, raw vegetables, and fruits with skins or seeds. About a day before the procedure, you'll transition to a clear liquid diet, consuming broth, tea, clear juices, without pulp, and gelatin, while avoiding red or purple liquids, as they can be mistaken for blood. You'll also be prescribed laxatives to take the day before the colonoscopy to completely empty your intestines. It's crucial to follow these instructions precisely, as inadequate bowel preparation can obscure the view and necessitate repeating the procedure. Number 2. Hydration. Preparing for a colonoscopy begins several days before the procedure to ensure the colon is clean for a clear examination. Start with a low-fiber diet, avoiding whole grains, nuts, seeds, raw vegetables, and fruits with skins or seeds. Transition to a clear liquid diet a day before the procedure, consuming broth, tea, clear juices, without pulp, and gelatin, while avoiding red or purple liquids. Staying well hydrated by drinking plenty of clear fluids is crucial, as the laxatives taken the day before the colonoscopy will cause frequent bowel movements. Follow these instructions precisely to avoid dehydration and ensure adequate bowel preparation, which is essential for a successful procedure. Number 3. Sedation and positioning. The colonoscopy procedure typically lasts between 30 to 60 minutes. It begins with the administration of medication to ensure your comfort and a pain-free experience, either relaxing you or inducing sleep. You will be positioned on your left side on an examination table, which facilitates the effective navigation of the colonoscope through your colon. This procedure allows the doctor to thoroughly examine the colon's lining using a flexible tube equipped with a light and camera, providing real-time images on a monitor for evaluation. Number 4. Insertion of the colonoscope. A colonoscope is a thin, flexible tube with a light and video camera at its tip. The doctor gently inserts the colonoscope into your rectum and carefully advances it through your colon. The camera transmits real-time images to a monitor, providing a clear view of the colon's interior. This allows the doctor to examine the lining for any abnormalities, such as polyps, inflammation, or cancer. The procedure enables the doctor to diagnose issues and, if necessary, perform biopsies or remove polyps during the examination. Number 5. Inspection and procedures. During a colonoscopy, the doctor may inflate your colon by pumping air or carbon dioxide into it to get a better view, which can cause a feeling of fullness or mild cramping. If polyps, which are abnormal growths, are found, the doctor can remove them on the spot using a small loop or snare passed through the colonoscope. This removal is crucial, as it helps prevent polyps from potentially developing into cancer. Additionally, the doctor may perform a biopsy, which involves taking a small sample of tissue from the colon's lining. This tissue sample is then examined under a microscope to check for abnormalities such as cancer or inflammation. The colonoscopy not only helps in identifying issues within the colon, but also allows for immediate treatment of certain conditions, making it a comprehensive diagnostic and therapeutic procedure. Number 6. Recovery. After the colonoscopy, you will be taken to a recovery room where you will be monitored until the sedative wears off. It's normal to feel groggy or sleepy immediately following the procedure due to the sedation. You may experience some discomfort, such as bloating, gas, or mild cramping, caused by the air or carbon dioxide used to inflate the colon. These symptoms should subside within a few hours. Once you feel comfortable, you can resume your normal diet, though it is advisable to start with light, easily digestible foods and gradually return to your regular diet. Monitoring in the recovery room ensures that any immediate post-procedure concerns are addressed, and you'll receive instructions on what to expect and how to care for yourself once you return home. This careful post-procedure process helps ensure a smooth recovery and addresses any minor side effects promptly. Number 7. Activity restrictions. Due to the effects of sedation, you will need someone to drive you home after the procedure. Avoid driving, operating heavy machinery, or making important decisions for the rest of the day. It's also recommended to avoid strenuous activities for a day or two to ensure a safe and comfortable recovery. Following these guidelines helps mitigate any risks associated with the lingering effects of the sedative and promotes a smooth post-procedure recovery. Number 8. Follow-up. After your colonoscopy, your doctor will discuss the findings with you. If biopsies were taken or polyps removed, it may take a few days to receive the pathology results. Depending on these findings, your doctor will provide guidance on any necessary next steps or additional follow-up needed. It's important to follow your doctor's recommendations closely to ensure continued monitoring or treatment as required for your health and well-being. This discussion ensures that you are informed about the outcomes of the procedure and any implications for your future health management. Potential risks and complications. While generally safe, a colonoscopy, like any medical procedure, carries potential risks. Minor bleeding can occur at biopsy or polyp removal sites, typically stopping on its own. Perforation of the colon wall is rare but serious, potentially necessitating surgical repair. Infection is uncommon but possible post-procedure. Additionally, some individuals may experience allergic reactions to sedatives or anesthesia used. It's essential to discuss these risks with your doctor beforehand and follow all pre- and post-procedure instructions to minimize potential complications. When to contact your doctor? After a colonoscopy, it's important to monitor your health and promptly report any unusual symptoms to your doctor. While mild cramping and minor bleeding are common, severe abdominal pain, significant rectal bleeding, fever accompanied by chills or body aches, or persistent vomiting should be addressed immediately. These symptoms could indicate complications such as perforation, infection, or other issues that require medical attention. Contact your healthcare provider promptly to ensure appropriate evaluation and management if you experience any of these symptoms post-colonoscopy. Early intervention can help prevent serious complications and promote a smooth recovery. Conclusion: a colonoscopy is a vital tool for maintaining colon health, detecting colorectal cancer early, and diagnosing other gastrointestinal issues. By following the preparation guidelines, understanding the procedure, and knowing what to expect afterward, you can ensure a smoother and more successful experience. Always communicate openly with your healthcare provider about any concerns or symptoms you may have, and remember that the benefits of early detection and treatment far outweigh the risks associated with the procedure. Thank you for joining us today as we explored the ins and outs of a colonoscopy. Remember, this procedure is a crucial step in maintaining your colon health and catching potential issues early. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more health-related content. Have any questions or personal experiences with colonoscopies? Drop them in the comments below. We'd love to hear from you. Until next time, stay healthy and informed.